Good morning everybody. Today is the day that I film myself having a smear test. So if you're wondering why on earth I've decided to film myself getting a smear test, it's because I had a meeting at the beginning of the year with Joe's Cervical Cancer Trust, and it was really eye-opening, and it was one of those meetings where I was like, is there anything I can do to help encourage more women to book in their smear tests, or kind of make people feel a little bit more at ease when they get their letter through the post. And I came up with the idea that I could actually film it and ask the nurse questions and show you the things they use and talk about, you know, how long it takes. I asked a lot of you on Instagram if you had any particular questions or you wanted me to show anything in particular, and I've made a long list of questions that the lovely nurse Jenny is more than happy to answer. I feel like in the 10 years of vlogging, this is it's a moment. I've never done this before. Here's me thinking I've overshared. Then I bring you into a smear. In all seriousness, I do feel that it's important, and it is something that I would have found very reassuring and also a great reminder had I seen something like this. I don't actually think I've even seen anything like this in school. There wasn't, I mean, you might have, but I didn't have any educational videos about smear tests. So yeah, there are a lot of people that have a lot of questions, so it's really important that they get some kind of education, reassurance, and just generally understand more about cervical screenings. So I was like, hey, what's that thing in Game of Thrones? I volunteer. That's the one. I'm gonna do it. I'm gonna film a smear test, and I hope that you enjoy the rest of this video. I'm going to be filming this for this vlog. I'm going to just make it its own video, to be honest, and I'm also going to be filming it for IGTV. So I have Maddie coming in with me, and I have Lauren, our creative producer, coming in with me as well. So, you know, the more the merrier. I'm not planning on showing them my foof. I'm just not sure. Maybe there's a boundary within work that's like, keep the foof to yourself. Don't show your colleagues your foof. Unless you're gonna get wild at a Christmas party and that's your kind of thing. Yeah, I'm not planning on them seeing. Of course I don't care if they see by accident. But that's the only thing I'm like, oh, I just really hope that Maddie and Lauren don't see my vagina today. That's all I'm thinking. I think because I'm not going into it feeling like I'm going for a smear test. I'm going into it thinking I want this to help people, and that's really altered the way my mind feels about it. Because if you have seen my previous smear test that I had in 2016, I was so nervous. I couldn't like eat properly for days building up to that because it was my first smear test. I had no idea what it was going to be like. And this one is my second, so I have a vague idea. I mean, it's been 3 years, and you know, my main kind of worry, if you will, was having to get my vagina out in front of a stranger, because I don't really do that. You know, I keep that to myself and my partner. So that was my worry, was how am I gonna like just take my pants off and just be like, well, here's my vagina? But they see them all the time. And actually I'm just gonna let Jenny like do all the talking, and of course afterwards I will share with you my experience. But yeah, that's what this video is today. So if you've clicked on this video, hi, I'm Zoe, and you can now come with me into my smear test. Firstly, thank you for allowing us to film this and for me to come in, because I think this will be really, really helpful for a lot of people. One of the most asked questions, I think, were people just wanting to know a little bit more about what a smear test is and how old you have to be to have a smear test.
Basically, starting from scratch then, so girls at the age of 24.5 get an invite letter, which is sent from what we call a primary care screening database. So everybody's on that database, so they would get their invite letter. And the reason it's 24.5 is because obviously the screening programme starts at 25, and it's to make sure that people have got their letter, that they haven't got a period, that they can then make an appointment to come and see the practice nurse and have their smear test done, and overall they reckon it can take sort of 3 to 6 months to actually make that appointment, so that's why you get that early invite. The actual smear test, if people have been sexually active, then it's a bit like being sexually active. I often will go and get a speculum, which we're going to obviously show on the film anyway, and I'll show them what it looks like. We discuss what the procedure actually is, so putting the speculum inside the vagina, and then I also show them the little brush that again we're going to see later, of how the sample's taken, and explain to them that it goes around the cervix, and they're the cells, they're the important cells that we need to take to send to the lab in a pot, and that's really how it's described to people. However, I always say to people, if you're very anxious, please come and talk to us, because so many people are scared of having a smear test because they don't know what's involved.
Yeah.
And the other big thing I also find is that people have had friends who've maybe had a smear test, and then the friend goes back and says it's such a horrible experience. It shouldn't be a horrible experience. It's not a pleasant experience, but it should never really hurt anybody.
That was another one of the most asked questions was, is it going to hurt?
Yeah. And the only way I can describe that is by the simple fact that everybody's cervixes are so very different. Lots of women have very sensitive cervixes. Other women probably don't even know you've done it. And we can't tell that to a lady. You know, we don't know how sensitive their cervixes are. I think if people have got concerns, I cannot reiterate enough, please go and talk to your practice nurse. Please, because rather than not coming, please just go and talk to someone, get a familiar face, somebody that you feel you can trust as well.
I think a lot of people, judging by what people were asking me, is that they felt they couldn't say, or, you know, if they were a bit worried, they felt that they couldn't tell the nurse that they were feeling a bit worried. But I think it's important to kind of emphasise that if somebody is feeling a bit unsure or a bit worried, that they can express how they're feeling, and I think that would make people feel a lot more kind of at ease and more comfortable.
And I think people should. I mean, we have a 20-minute appointment for our smear tests. I'm aware that lots of surgeries don't have that luxury, and it might be 10 minutes, it might be 15. We always have had 20. Simply for that reason is, you know, the woman will come through the door. You want to build a rapport with your ladies before you do anything.
Yeah.
You know, you want to find out their previous history, you want to find out if they've had a painful experience, also even down to the simple things of what size speculum's been used in the past, you know, because that's really important.
A lot of people asked, how does the HPV vaccination play a part in smear tests?
We are aware that the girls who had the first lot of HPV vaccine are now coming through. This is my personal view. I think that the vaccine was sold very badly in the beginning, and I think that's one of the big issues why we are not getting the 25-year-olds coming in for their smear tests, because they think they've had the vaccine,
so they're fine.
They don't need it. I'm really hoping that now the boys are involved in September, that the vaccine will be sold in a different way, and that it is to prevent cervical cancer. Fine. But it's only certain strains of the human papillomavirus that we know are most prevalent to causing cervical cancer. The vaccines we give only covers 4 strains. There's still over 40 strains out there that can contribute to cervical cancer.
Which is why booking in your smear test is so important.
Exactly.
Yeah.
Exactly.
A lot of women were quite self-conscious about getting undressed from the waist down for the first time. You know, they were asking whether they should do anything in preparation, should they be shaved, should they have shaved their legs, what pants should they wear, what clothes should they wear, and people who felt a little bit more body conscious, like, do you have any advice or any...
Yeah, there's exactly what you're saying. People are very aware that they're going to undress in front of a stranger. I teach cervical screening to practice nurses, and one of the main things we say is we're not allowed to use blankets anymore, we have to use the couch roll. But a little bit of dignity by a couple of sheets of couch roll goes a long way. Making sure we pull the curtains around the bed. We always lock the door. I always say to ladies, come in a skirt, because then you can use, totally. Zoe's got her skirt on, because then you can just hoik it out.
Yeah.
And obviously you should be behind the curtains undressing anyway. We try to leave a chair so that people have got somewhere to put their clothes on. And I think a lot of it is the rapport you have with that client. you know, I always say, I'm going to lock the door now, and you can often see their shoulders dropping.
Just relaxing a bit
because
more.
they think then, yeah, I'm in this room and I haven't got to worry too much.
Also, you've seen it all, haven't you?
Yeah,
there's no right or wrong, I don't think.
No, and patients will apologise to me and say, I'm really sorry, I haven't had time to shave. And I just say, you know, it doesn't matter to me whether you shaved or not. I'm not looking at what you're like down there. You get all sorts. You get girls with piercings, you know, it's all normal.
Yeah.
That's not important to us. We're not here to judge. We should never be here to judge.
Lots of people ask, do you need to have a smear test if you've not had sex?
Yeah, this is a really, really tricky one. And I would pose the question back, what do you mean by not having sex? So, if you've never ever had penetrative sex and you've never ever had foreplay and you have never been near a man or boy or even sex toys, I would say then your risk is minuscule, okay? And you need to make that decision between yourself. I would say that it's a decision that needs to be discussed between whoever is going to take that sample and the patient, and you make that decision together.
Yeah.
Okay. The nurse should never say you need a smear test. It's something you talk about properly together. If you're with a partner and you've had foreplay, and or you've used sex toys, then yes, I do think it's very, very important you have your smear test, because the human papilloma virus lives on sex toys, it lives on your hands, and it actually lives for quite a long period. Okay? So we know boys haven't been vaccinated at the moment, and so boys, you know, there is no way of us knowing if a boy is HPV positive, and the only way we know a woman is HPV positive is by her coming in having a smear test.
Yeah.
There are no other signs or symptoms.
Is it easier if you're relaxed, and do you have any advice to make people feel more relaxed when having a smear test done?
Yeah, it is much, much easier if you come in and you're relaxed. However, you can see patients are very tense, they don't know what to expect, which is why for us again as nurses we should be sitting and explaining what we're doing, because we need to gain consent. So I teach this and I do it myself, so when my ladies are up on the couch, I will explain what I'm doing step by step. We should all be explaining that so there are no shocks.
Yeah, it's all about communication, isn't it? If they're having it done and it feels painful and they say so if they said to you, oh, this feels too painful, what sort of happens there? Like, would you kind of stop and give them a bit of time? Or if someone was finding it really uncomfortable and they were like halfway through the test, what would happen? Okay, so what I would often do is I might say, shall we change the speculum? Shall we use a smaller speculum and see how that goes? A lot of the pain is often when the speculum is opened. So again, what you can do is maybe take the speculum out and reposition it into a different, you know, going in at possibly a different angle, because not everybody's cervix is as you focus it in line. It can be difficult, so you may be moving the speculum around to actually find the cervix. I actually sit on my stool at the end, and you can actually physically see when a woman is tensing, because her buttocks will tense. Yeah. And my stock phrase is, and probably a lot of nurses will say this the same, so try and relax. It's very easy for us to say that, but for the patients to try and relax, it's another kettle of fish, isn't it? Yeah. We've even had ladies here who, if they have found things to be very, very uncomfortable, we may have given them a little bit of oestrogen cream, which they can use internally to make, not more pleasant, but to make things a bit easier when the speculum goes in. What does that do? It gives them a bit more lubrication down below. Okay. It tends to plump the cervix up so that to take the sample is a bit easier. Got you. I've even given, obviously with the discussion with the GP, we've even given a couple of our patients medication to try and get them to calm down. So there's lots of things we can actually do to try and support the ladies. Yeah. So your smear history is normal. You've never had any abnormal smears, and this is your second one? Second, yeah. So you are what we call a routine recall. I then need to find out if you're on any contraception. Yes. So you're taking hormones. Yeah. It's not your first smear. And then what I need to do is find out when your next period is due. That's as far as I go with this form, okay? Because I've got my little rapport going with my lady.
the next things I have to fill out are whether I've seen your cervix, whether I've sampled it, so I can't fill that out
Until you've done it.
until I've done it.
Yeah.
So, then my next thing is,
Come and sit on my pink couch.
yeah, come over to my lovely couch. I'm going to lock the door,
Okay, yeah.
and I'm going to pull the curtain around you, alright?
Not that it makes any difference because we've got Maddie and Lauren anyway.
Alright, that's for you to cover yourself up.
Do you want me to take my shoes off? Silly question.
It's up to you, it doesn't matter, because your feet. So what I
go
want,
in there.
yeah, what I want you to do when you're ready is to come, I mean you've got your skirt on so you might not want to do that, but your bottom needs to come right on the end here,
Yeah.
and your feet need to go in the stirrups.
Got you.
And please don't bang your head on the leg.
Okay. Right, where are you going to go, Lauren? Because you're at the
Business
you're at
end.
the business end down there. Okay, so
I won't film you.
pants off.
Thanks, off.
Where should I put them?
You can put them on the chair.
Do you want to put them over here?
Alright.
Oh, come over here.
Smells very weird. Just filming your waist up.
Casual.
Just next to you, Maddie. Okay, yeah, just have to. I might see.
It's alright, we'll edit it this bit.
Is my bum close enough to the.
You just lay down for the minute because I
Okay.
need to get my equipment ready and then I'll take what you need to.
Are you the only one with a pink couch?
Yeah.
Love that.
So, this is the pot that we use, and obviously what we have to do is check the expiry date. I'm not using an out-of-date pot.
And what goes in that?
This is your sample going to go in here.
Got you.
Some white jelly.
First time round, I didn't ask a lot of questions. She was like distracting me, so I had no idea what was actually happening.
So we have large, or wide they're called. We have a medium long, and we have a medium, and then we have a small, and then we have a virgin. So you all have, so there's 5
Quite a
different
lot
speculum.
of different sizes.
Yeah.
Oh, okay.
So that's a medium.
Plastic.
Plastic, we don't use metal anymore. Very rarely
Oh,
do we
you
use
used to
metal.
use metal.
We used to use metal speculum, which were clunky and cold and
I can
horrible.
imagine.
So we used to warm them.
Also, I didn't realise, because I didn't really look last time, that it's quite tapered at the end. I thought it was just round all the way to the end. I don't know why.
So that's probably what the average lady would have.
Yeah.
Okay, this is a small one. If you want to compare sizes,
That's quite different.
yeah. This is the virgin. So even the virgin, can you see, is
Much smaller.
Slimmer.
Yeah.
Oops.
Oh yeah.
Okay. Are you happy to go for a medium?
Yeah, whatever you think.
Yeah.
Yeah.
Because you're not a virgin, are you?
No.
Okay.
Surprise, surprise!
You lay yourself back on the pillows.
Yeah.
You then need to bend your knees up and put your feet in. That's it.
Like this?
Yeah. Make sure your skirt's tucked right under, lovely. And then can I just get you to lift your bottom up and sink down? All right. And the reason I do that is because then, for whatever reason, your cervix will come further forward, and it's in the right position for me.
Okay.
Okay. So now you're going to go up in the air.
Fabulous.
I use KY jelly.
Mm-hmm.
Because I think it's kinder for you, and I literally use a tiny little blob. Just on
Well, that is less than I thought it would be.
yeah, because if you use too much, it interferes with the lab. Okay, I've undone my pot, so it's all ready, and then this is the brush we use. Okay, so it's a very soft brush. However, what I would also say is sometimes it can make your cervix bleed. All right. And that is normal.
That happened to me last time.
That is very, very normal.
Oh, I'm nervous now. I hadn't thought about it until this moment.
Okay, so I know the girls at the reception desk said, aren't you scared about doing this? I said, well,
No, it's just a vagina. I do it all the time.
okay, so I'm now going to put the speculum in, okay?
Yeah.
So I'm just going to touch you. And what I would like you to do, if at any point you are uncomfortable, you tell me, or if you feel this is even too big. Are you okay?
Yeah,
Yeah.
all good.
Okay, so now you're going to get that stretchy feeling I was telling you about.
And that's where you're opening the
That's it.
speculum.
Yeah.
Got
Are
you.
you still
This is the
okay?
bit that feels kind of weird.
Yeah, it is a very strange feeling. You still okay?
Yep, all good.
Well done. So, I'm now going to take your sample,
Mm-hmm.
okay? This is me using the brush. There we go, you're all done.
Oh, right. How long did that take from start to finish?
No, a couple of seconds.
See, look, made me bleed.
So yeah, there is a bit of blood,
Mhm.
okay, and I'll explain the reason probably for the blood is because you're on the pill.
Ah.
So when you're on a combined pill, you often do bleed.
Yeah.
So this, we have to bash the brush in the pot really, really hard to make sure we get all the cells off. It's wobbling. Okay, so then I'm going to lower the couch down. And you're all done. Sometimes you can bleed because of the estrogen in the pill.
Yeah.
All right. Sometimes you might bleed a little bit easier because you have got also around your cervix, and I think when I read the letter, this was explained last time to you. You've got what we call ectropion. They are normal. Okay. They
What
are
is that?
It's where, so like when you have a graze on your leg, your arm, whatever, you have a graze on your cervix, which is absolutely normal for anybody who's sexually active.
Oh.
Okay, but because it's in a warm, wet, moist area, it can often take a long time to heal. You've also got the combination of you being on the combined pill, so the estrogen can make you bleed a bit more.
Mm-hmm.
And I would say, we say long-term pill use is probably not recommended any longer.
Yeah.
And by that we say 5 to 10 years. So
Mhm.
you've only been on it a couple of years.
Yeah.
So if you're happy on it, I would say stay on it,
Yeah.
because you've got your ectropions as well contributing probably to the bleeding.
Okay. So will I always have that forever?
Possibly.
Oh.
Until you get menopausal and everything all
And then it
dries and
stops.
shit.
Okay.
Yours now, because of the couch, it comes into view much, much easier.
I think we'll
Yeah.
let you get your pants
It's okay, I'm
on.
just gonna put my pants on.
Yay!
Just to say also, the other thing that some people do feel a bit strange after their smear.
Oh yeah, that was one of my questions.
Yeah.
Is like, if somebody, is there any like after pain or?
Yeah, some people can feel quite sore inside because I think of us opening the speculum because of you interfering with their, it is right in the middle.
It
isn't
does feel
Yeah.
much more high up than you think it's going to feel, doesn't
Yeah.
it? Yeah.
Your samples are going to take 12 weeks to come back. You should get a letter sent to you in the post. If there is any problems, what we do here in this particular area is you would be contacted by colposcopy. So if your sample came back showing that there was any HPV, and it can come back at different levels, so we can have what we call mild, moderate or severe dyskaryosis, which means that's how the damage to the cells has been. So mild is a tiny bit of damage, moderate, and then severe. So severe is the worst. And then the next step would be is that if someone had severe, they would then possibly go on to have cancer if they didn't get their severe cells treated.
Yeah.
Okay. So we very, very, in all of my sample taking history, I have never ever seen a cervical cancer. Okay, I've seen plenty of pictures, but never ever in a lady. I've taken samples on women who have had severe dyskaryosis, so they would go straight to colposcopy, and they would have treatment, and the treatment they would usually have is what's called a LETS, which is where they actually cut the bad cells away, and they would also then they stain the cervix up to see what depth those cells are, and then they know what the depth is to cut away.
Yeah.
And then basically those ladies are usually called back again in 6 months' time to then look at the cervix again, another sample's taken to make sure that all of those abnormal cells have gone and not regrown. So for moderate and severe, they would be referred to colposcopy. Usually if a woman has mild and it's HPV positive, then she would still be asked to go to colposcopy, and they would have a look at her cervix. And again, they would stain it up and they just literally have a look. And probably with somebody with mild, they would just be keeping an eye on her, so they might then ask her to come back in 6 months or a year's time.
Okay.
Cervical cancer is a very, very slow growing cancer. It can take up to 10 years to grow.
Oh wow.
Okay, so that's why we do the
Yeah.
intervals we do. However, very, very rarely it can grow very, very aggressively. Now we also have a pathway for women who come for vaginal bleeding, and so if a woman is up to date with her smears, but for whatever reason she then gets vaginal bleeding, we have a particular pathway to follow. What I personally am finding is that because girls are coming in later for their smears, so i.e. it's not 24 and a half, it's sometimes 26, 27, 28 for their first smear, there's a lot of those first smears are being abnormal.
Because they've left it too long.
Yeah.
Okay.
So thankfully they've come in at that point rather than they leave it and then it's actually full-blown cancer.
Yeah.
That's why it's so important.
Yeah.
I mean, I guess maybe it's a bit remiss of us when a woman turns up for her smear test. We actually don't talk a lot about why they've come.
Why they've come, yeah.
We do, obviously, the majority when they come have come because they've had their letter. And they know it is, I mean, they talk about it as being their cancer test. And I think that's something we need to get away from because it's a preventative to prevent you developing abnormal cells. And let's face it, the majority of samples are normal, but I do think a lot of women actually don't appreciate what contributes towards cervical cancer. You know, lifestyle is a huge contributor. 4 or more full-term pregnancies is a big contributor if you're HIV positive. If you've got a low immune system, which you would have if you're HIV positive. If you're a smoker, you know, they are huge contributors. How many sexual partners you've had, the age when you're first sexually active. You have plenty of chaperones in the room.
So if you were a bit nervous, could you bring somebody else in? You can?
By all means, yeah.
Oh, okay, that's good to know.
Lots of mums come with their daughters. Very occasionally they come with a husband. Yeah, girls often come with another girlfriend.
Yeah, okay.
You know, I might sound as though I'm cervix crazy, but it's my... It's my
that
love.
should be a badge.
It's what I've always done.
Yeah.
And, you know, and probably for the last 15 years, I've taught nearly all the nurses in Sussex, Surrey and Kent.
Love that.
How to do smears. You know, I tend to do all the difficult ones here. I was a nurse consultant for cervical screening. I've done loads and loads of stuff. It's just always been something I've enjoyed, which even my family think I'm mad.
Bye, Sals.
Good luck. I should have said it to you behind the curtains, but I usually do say to the ladies then, while they're getting their knickers on, do you check your breasts yourselves? As nurses, we are not allowed to check a patient's breasts because the onus should be put onto the patient to be breast aware. And I always say to women, you need to check your breasts after your period, at least once a month, and it's feeling up under your armpit, you've got breast tissue under here, all over your breast fairly firmly with this part of your hands. So you're going all over here and everywhere. Same on the other side in the bath or the shower with some soap on your fingers and it will glide over easier. And the most important thing also is to find a mirror, stand in front of the mirror with your arms up above your head. Look at the underneath part of your breasts because that's the bit we tend to miss. And all on all of your breasts, what you're looking for is puckering, dimpling, so how the skin of an orange looks. Because if there's any puckering or dimpling or also tethering where the skin's pulled in, that could be an indication of there being something abnormal going on. Okay, so breast cancer, it doesn't necessarily have to be painful. All right. Some people will say they get like a burning sensation around where the lump is, but they might also then not get any pain, but they've examined themselves and felt a lump. And the idea is that they go to the GP.
Checking.
Keep checking. Lots of women get hormonal lumps when their period is due, and they are often just normal lumps. It's when those lumps don't disappear with your hormones that you need to worry.
Thank you. It's been amazing. It was really nice to meet you too. Thank you. Perfect. Thank you. Have a nice rest of the day.
You too. Enjoy your weekend.
Thank you.
Do you have more chairs? We need one more chair, I think.
1, 2, 3, 4, 5. Oh yeah, meant with 6.
Have we all had a smear test?
No, not everybody.
I've got mine booked for Monday.
Oh. Lauren's got hers booked. Dan hasn't.
You haven't?
It's good to be honest because I think lots of people late.
Yeah.
I mean, mine was a year late. Mine was a year late too. I was 26.
You were pretty on time.
I was very on time.
I love how much,
that's
there's
like
such
Maddie.
different groups of people, isn't there? I feel like there's the group, like us obviously, and you as well,
Yeah.
who are like, okay, I just need to get this done, let's do this turned 25 on the phone to the GP.
Tell me about my vagina.
Yeah.
I was more in the take the letter and just hide it.
That was me. Except with Carrie, I was like, Carrie, you need to book it. Come on, Carrie, you need to book
We are
it.
wonderfully open, I think, compared to most offices. Like, have you ever had to look down?
Yeah. That's so true. But you had done some recently.
Recently, May, end of May.
First one.
Which was a year, and I'm still waiting for the results, as you guys know. Still, we are on week 10.
Have you chased them?
I need to call them, I'm going to call them today, but you just
I
said,
just got told it could take 12 weeks for me.
so I think there
I
was
got
quite
mine
a
within
few
2
then.
weeks.
Yeah, see, I think it's different depending on where you are. So
Yeah.
I got mine really quickly too, so I think it depends on the labs that they're using or something. I don't know. So do you want to tell us how it went?
Oh yeah. So yeah, it went very well. I did. Is that some ropes?
Yeah, they're just
Okay.
swinging at the moment.
I was like, it went very well, but I think I'm losing. It was absolutely fine. I was definitely much more relaxed than the first time because I knew what was happening. But also, I was saying to these guys in the car, the first time round, she didn't say to me like, this is what a speculum looks like, this is what this looks like. She just did it. So this time, it was so interesting to actually see everything quite close up because I didn't look last time.
I think
was
that
like,
fear of the unknown was the worst bit, because
Yeah.
you assume it's going to be 10
It's all
times
in
worse.
your imagination, isn't
Yeah.
And also, you want to be in and out there. You're like, you don't want that. It's like a wax. You don't want that to.
I'm too scared to get
You know.
waxed.
You want to be in and out. Like, just get on with it.
Not a wax.
Maybe I would do a wax now, but then
That's painful.
Yeah. I don't know, my smear was quite painful. Like,
Yeah,
I
Carrie
know
did-
some people say that it's
Yeah.
not painful. Mine was quite painful.
Really?
And I was crampy for like 2 days afterwards.
Really?
But that's pretty normal. And it wasn't like unbearable. And it's not enough to make me not go again.
Yeah. I think it's just so different for
interesting.
everyone, isn't it? Because mine didn't
Yeah.
hurt at all.
Are you
Mine
on
didn't
the pill or
hurt.
something as
Yeah.
well? Yeah, because my first one, when I was on the pill when I was 25, I bled that time, and she said to you today
I
that
bled
that's
today.
a common like if
I
you're
wonder
on
if
the
it
pill
affects it, yeah.
and you have more estrogen, you're more likely
Yeah,
to
that's true.
bleed. Whereas previous ones I've had since the first one, I haven't bled because I'm now off the pill. So it could be that.
Yeah, it'd be interesting to see how the next
Yeah.
one goes. But it wasn't anything that was so bad that's made me go, I'll never do that again.
Yeah,
Yeah.
no worse than a period.
No,
No.
no, not terrible.
how was your first smear? Were you nervous? I can imagine you not really being very nervous.
I don't really care about being naked. So I just didn't really think about it. I think my whole thing is until I was about very recently, like 21, I didn't really know what it was. Like I never had any. My parents never said anything about it. No one ever told me what it was.
I think it's only been public information. I've only been aware of it recently.
Yeah. Or I didn't know what it was testing for anyway. But
Yeah.
mine was fine. I went in, was out within 5 minutes.
Yeah, so quick.
Didn't bleed.
Yeah,
But
so
I'm lucky. But it is just different for everyone. Isn't it?
Absolutely.
Yeah, definitely.
Yeah, and I think there's different things that bother different people, because it's funny you say like, I'm fine being naked.
Yeah,
Like,
that was my worry.
Yeah, I know that's a big worry for some people. That it wasn't as much of a worry. I was like, it's gonna hurt. That's my big worry.
Yeah.
But in the end, it wasn't that bad. So
Yeah,
there's
whereas
lots
for
of
me,
barriers
I was
there.
only ever concerned about the results.
Yeah.
Like I
That's
didn't
what I was
really,
worried about,
I didn't
yeah.
really,
My
I didn't
concern.
really think about like the procedure. But then I have like I'm quite vigilant with my waxing, just so everyone knows. So like that part of it, I was just kind of like, well,
Here's
like,
my badge.
whatever.
I don't
Like I
care.
didn't
Yeah,
really
they
care
see-
about that.
I don't know how many a day. but-
She said she's
Yeah.
been doing it for 20 years.
Imagine how many
Yeah.
cervixes she's
She
seen.
doesn't
Yeah.
care about
so
you.
many
Yeah.
vaginas.
I didn't
Yeah.
care about that. It was, I actually probably had more stress after it because I was like, okay, now
The
I'm in the
waiting.
period
Yeah.
of
Isn't that
waiting.
interesting?
Yeah.
Especially if you have to wait
Stuff.
12 weeks.
Well,
Yeah.
That's
yeah.
what's worrying me more.
See, I came out, was like, done, forgotten about it. Now I'm 10 weeks down the line, I'm like, oh, I should probably find out what those are. But I guess it's interesting how people
Yeah,
everyone
so
do it differently.
When I had mine, I got a text back saying I had to go back because something had gone wrong. The
Oh.
results were.
They haven't got enough.
Yeah, they
or
didn't
something,
have
yeah.
enough or something, so I had to go
That's quite
back. So
common, I
then,
think.
then I was really panicking, but then it
So
was
did
fine.
you have the test done again?
Yeah.
And that was
I
fine?
think that's really common though. I've had friends who that's happened.
Yeah.
And she did say sometimes if you bleed too much, it interferes with
Yeah,
your
the
sample.
cells.
Yeah, and then you have to go back.
Yeah.
But I think that's quite normal.
Yeah.
And I was just saying to these guys, and I think you had this as well, because Zoe's was really easy today. I had it where she made me put my like hands under my back to be able to tilt my.
That's right.
Yeah. Mine she couldn't find the cervix, so there was a fair amount of digging around.
Yeah. Whereas today it was like,
yeah, I think that was
boom,
why it was
really.
My
So-
cervix must just be right there.
Yeah, that was already. Bingo.
Yeah. Whereas I've had it where someone's put a pillow under me before, or like made me kind of make a fist and put that under my back, and then they find it more easily.
She did say stirrups. Not all GPs will have the beds with stirrups on.
Did you have stirrups today?
Yeah.
Did you?
No.
Yeah, mine was feet on the bed.
Feet down.
But she did say stirrups makes it easier because you sort of fall into the place that you're supposed to be.
I don't remember when I first heard about having a smear, like what it was and that you had to have it.
I certainly didn't understand HPV
No,
and anything like that.
no,
I still don't think I understand.
I don't remember anyone, like my mum or my stepmom, anyone like saying like this is admitted, you have to go and have it. It's kind of like some weird like thing that just kind of came into your knowledge over years, but no one really knew what it was about. And I think that's so interesting now that we've all got to go have this thing. We didn't really know what it was and what it was for. And today was so informative, like just even like all the stirrups and everything. But I think it's so good that we do talk about it because it's just so important.
I think it's probably because in the UK you can't go until you're 25, so there's no point in even talking about it until
That's
then,
true,
because
yeah.
you don't have to go.
It's
So
like
that's
the
an age
unspoken,
thing.
like when you reach 25, you're going to get the letter.
Whereas in other countries,
That's literally what people say.
Yeah,
I was going to say the letter.
letter.
In other
We're only
countries they
talking
go
about
out
the UK
Absolutely.
here.
Yeah.
That's a really
And
good
that was
point to
something
make.
when we posted about Joe's Trust before, there were so many people going, oh my god,
Why
I've been
is this
doing
a
this
big
since
deal?
I was 16,
Yeah.
18.
That's a really good
Yeah.
point.
And they think of it as nothing.
Yeah, I'm sure somebody in Germany was like, we go every year.
Yeah.
And I was like, oh yeah, that's like literally like a dentist trip.
Is it
It's like,
Every 3 years, unless you. So because I had, I think it was my second smear. They came back with I was HPV positive, and I had it was only mild like signs of bad cells, but after that I went every year for a couple of years. Once I was clear, like positive, like I don't mean positive, like clear tests came back. I think for 2 years they put me back on the 3-year cycle. So it really depends, I think, on what your results are. But I think 3 years is the standard.
Why do you think that less and less people are going? Because she said it was an all-time low. Like, why do you think it is that people over like 28 are going just like, or like, well, she said like 38 people were having their first smears. Why do you think it's people just aren't going at 25?
People that are 38 are going for the first time.
Yeah, she said that. She said that so many people who are 38
In
having
their
their
30s.
first smear.
I think, well, I don't know, I still don't really answer it, but I think people just don't know about it. People don't know that they
For me,
have
it
to
was
go.
just like straight up fear. Like I knew what it was, but I just didn't want to go, so I didn't.
yeah.
And then I was like, oh, Zoe nagged me enough, so then
Maybe it's people
There's
not
so few people.
knowing what to expect.
Yeah, maybe. I think there's so few things in life that you do that are preventative. The dentist is basically the only thing we all do on a regular basis that is
to stop our teeth falling out.
to stop something in the future. And this is probably the only other thing. And so you kind of don't really think about. You basically
wait until you have
wait
to.
until you've got something, and then you go and fix it. Usually.
Yeah.
So I think people just don't
That
really think in
mindset.
a preventative way because there's not. I don't check for other cancers quite so.
that's so true.
Yeah, that's
regular.
true.
Being able to understand the absolute benefits of it, and I really understand that it is so difficult for so many people, and there are so many barriers that people might have.
Yeah.
However, once you can get your head around the fact that this is such a great opportunity, and as you say, it is purely preventative.
And it's free.
Yeah.
Yeah,
it's
God bless the
great.
NHS.
But also, I wonder whether it's the Jade Goody effect as well, because I think it peaked then
Yeah,
that's
in
true.
the UK because of what happened to her, and then I think it's like so declined because people you get a bit complacent with everything, don't you? And you
Yeah,
sort of
people
don't
just get busy
Yeah.
and don't. I think,
Prioritise it.
yeah, and I think a lot of people, I can't remember who I was speaking to, but they were like, people just get busy, like life gets in the way, and because, like you said, it's not something you're fixing. It's not something that you're thinking, I need to have this fixed. I need to get this done.
What camp I'm in.
This is the Dan camp.
It's not
It's
urgent,
that
so
I
it's
don't
not a
want to go.
priority.
It's that I need to sign up to a doctor since I moved here, and it's just like getting around to doing it.
Yeah.
When I actually don't mind going at all. I've had like STD checks. It doesn't It doesn't bother me.
It's just
And maybe it's
not the top of your
subconsciously
priority
like,
list.
oh, it'll never happen to me, which is such a dangerous way of thinking.
Fine, yeah, but it is like a,
Yeah.
but such an easy mindset to slip into as well.
Yeah, and I think that's probably what a lot of people have. It's
Yeah.
not
One of the
all
most
like, oh no, I'm scared. It's like, just haven't got around to it.
Yeah.
I think
Definitely.
after watching you today, that took less actual test seconds, under 2 minutes. I mean, I guess realistically you're taking half an hour of your day to get to the doctors, to sit, to wait, to come back out. If you think of it like that, it's just half an hour. But when people say it's so quick, that was so quick. I was like, wow.
Yeah.
Swabbed, you're out.
Even though I found mine quite unpleasant, I was shocked by how quick it was. And I think if I'd known, even though everyone told me, which is stupid that you don't listen, but even if I'd known it was so quick, I would have done it sooner.
Yeah.
Joe's trust was saying that they feel that a lot of women are not going also because of like body confidence and how they feel in their bodies and having the confidence to kind of be naked from the waist down, which I think is really sad.
That's really sad.
Yeah.
I get it.
Yeah.
I totally get it.
Same.
Because, not everyone is confident to just whack your pants off.
Especially not to somebody you've never met before and you've literally just like shaken hands with and walked into this room.
Is it normal?
Yeah, is my vagina normal? Do I need to shave? Like,
But no one's vagina is normal. Everyone's is different. And
Exactly.
these people see thousands.
So many. I think as long as you feel comfortable and like happy, like I wore a long skirt today and she did say like, you know, wear something that's easy or, you know, just feel comfortable, take somebody with you, which you're allowed to do, which I didn't realise, but you can. Air your concerns. I think a lot of people don't feel like they can say, like, I'm a bit nervous about, you know, you seeing my wobbly bits or you seeing my bare vagina or...
Did you feel better having people in the room?
Yeah.
Yeah.
But I think I just wasn't as nervous because I knew I was filming it. If I was on my own, I would have been a bit more like reserved and overthought it more.
Well, there you go. Everyone just take a camera.
Just vlog it.
Make a little party out of it. The first one's always going to be the most difficult.
The anticipation is a lot
unless
for
something
that.
else happens to you, obviously. But in terms of like the nervousness and not knowing what to expect, the first one will always be the hardest. So once you get that one out the way, like now, you know, obviously I was a little bit nervous the first one, but now it's just kind of.
It's like getting your teeth looked at.
Exactly. It's like going to the
Those
dentist. You just go, don't you? You know, grin and bear it.
Just opening up a different
vessel.
So Dan's gonna
But it's honestly at the top of my to-do
get
list.
her doctor
Pushed
sorted.
up. Pushed up there.
We should get you to report back in like a week. And
She's
find
going to
out.
have you achieved?
That's going on
I'm actually
Monday.
quite excited now. I know it's
Are
Monday.
you?
I'm like, yeah, I'm going to do it.
I wish.
Join the club. Everyone needs to join this club.
Yeah, I kind of wish I knew more about it before I went for my first one. Because I didn't really.
Do the
It would
research.
if I had.
much less stressful.
Yeah,
I mean, there's
100%.
enough out there these days. So.
Yeah.
I was just sort of imagining like this giant, like Victorian tool.
Glass.
Yeah.
I thought they were glass.
She
I
said
don't
they
know
used to
why.
use metal.
That's what I was
I was like,
expecting.
that's going to
Yeah.
get big fingers going to clamp you
I
over.
meant to like met one my first time.
Maybe.
Yeah, they said
No,
they
it's
used to use
plastic.
metal ones.
If you've had your letter, if you've had your letter, look it.
Look, yeah.
Happy vaginas, everyone.
Happy vaginas all round.